How are you, students? Today, now our lecture, you see, continue. Today, continue topic F40-49, dissociative disorder and somatoform. Dissociative disorder, this is today topics. Please rewrite definition because it's very important to understanding. Definition is difficult, you see, but during lecture, I hope you understand what is the definition. Dissociative disorders, it is disorders which characterized by loss of partial or general integration between memory on past, conscious of the sensation from one side and control movements from another side. Now, for example, with dissociative paralysis, maybe you know what is it paralysis, but paralysis may be after organic problems, after severe trauma, maybe after stroke, maybe there are organic and the patients cannot control that because organic disturbances, injury. Here, the functions is normal, organic pathology absent, but patients cannot control movements, for example, in the leg. Dissociative disorders, there are general characteristics you see. For example, firstly, must be present psychogenic factors. Every psychiatrist finds psychogenic factors and collect information from relatives. Onset usually is suddenly, but maybe gradually starting, and chronic development. But usually we observe onset is sudden. Dissociative disorders which continue more 1-2 years before visiting psychiatrists have resistance to therapy. If sudden symptoms appear, usually family doctors must direct this patient to psychiatrist for consultation. Patients with these disorders usually deny connection between clinic symptoms and psychic trauma. Usually patients consider and sure they have organic pathology or somatic pathology, but really these symptoms appear after psychic or mental trauma. Diagnostic science. You see 3 points here. First point, being clinical science for different types of dissociative disorders. So we see the clinical science, there are many clinical science. Then second point, absent anything physical or neurological disease. Here we exclude organic stigmatizations. And then we must exclude another disorders, for example, drug abuse. Maybe person has discoordination of movements due to the alcohol intoxication and so on, and other drug abuse. And third point, clearly a connection by time in arising dissociative disorders after stressor influence. In spite of patient denying this, sometimes we discuss with patients because patients denying the present influence of psychogenic factors. They consider it is not influence on his behavior, on his health, and so on. That is in the third point. We must, every time on the class, I explain chronological connection. What here, third point, it is explanation of chronological connection. We find connection between psychological problems, mental trauma, and appearing symptoms of dissociative disorders. Structure in this F40-49, this subchapter, dissociative disorders, includes, you see, these disorders. Please remember, the name you know, but before this terminology, you see the new concept dissociative. In the previous classification, it was terminology hysterical. Now in the ICD-10, another terminology dissociative. You see dissociative amnesia, dissociative stupor, dissociative fuga, dissociative disorders motor and sensitivity, and dissociative spasms or seizures, and others. You know this all terminology. You know what is it amnesia, you know what is it stupor, and so on. But first word dissociative give you understand that this disorders, amnesia, stupor, fuga, arise after influence stressor factors for this person, for this patient. Now start from first, for example, dissociative amnesia. Main diagnostic signs. Partial or general amnesia on recent events. These events are characterized by stress and trauma character for this person, for this patient. Absence organic disorders of the brain, infection, severe fatigue, we must exclude another disorders, and chronological connection between stressor factors and arising symptoms. Usually this amnesia on the very, very important for this person stress situations. Differential diagnosis with organic amnestic disorder, you remember F009, maybe trauma, maybe coma, maybe after this disorders person has different kinds of memory disorders. Here retrograde amnesia is present usually. Retrograde amnesia or maybe concrete, so during maybe accidents this person does not remember. Because does not remember what happened with during the situations or what was before the situations. With simulation or feigned behavior or simulation. Conscious behavior for avoiding court situations because of fear before prison. No, for example, some person who made crimes in order to avoid prison, they start demonstrate symptoms of mental disorder. And it is simulation behavior or feigned behavior. We must exclude. So we exclude organic and different kinds of amnesia and, for example, simulation. Usually they simulate, the person say, I don't remember about this crime. It is not he made this crime, and so on. Demonstrate amnesia. Next, dissociative fuga criteria. Being the signs of dissociative amnesia, previous topic, travel or remove in space outside usual life. Take care of yourself, for example, continue to eat, to wash, maybe to care self, simple social communication with unfamiliar people. Person, for example, can buy the ticket on the bus, goes in cafe, ask waiter to bring him cup of tea, maybe bread, and so on. So simple communication may be present. Duration may be some hours, days. But you remember, usually at the epilepsy, fuga, it is very, very short unconsciousness condition during some seconds usually, and we say about trance. What here, dissociative fuga, for example, it is written in the ICD-10, but we psychiatrists think more better right here dissociative trance. Identical situations, identical conditions. From outside, the behavior of patients is perceived as normal for another people. For example, if we ask another people around people about behavior of these patients with dissociative fuga, they say the person alone walking during street maybe in another place, sat in the cafe, for example. They don't notice any changes maybe in this behavior. Differential diagnosis should to provide with epileptic trances. Patient has another spasms in anamnesis. If it is epilepsy, another symptoms, personal change you remember during epileptic seizures, the person become very viscous, thinking, movements, very slowly becomes decrease cognitive functions and so on. Then usually the epileptic trances usually absent stressor factors because it is organic pathology, or established diagnosis of epilepsy, or we have diagnosis of epilepsy. And second, identical simulation. We must exclude simulation in the examination of juridical psychiatric examination. Next, dissociative stupor. Here, being the signs of stupor, lying or sitting without movements a long time, muscle tension, position of body, breathing, open eyes, patient does not sleep, and in consciousness. Now you remember this definition of the stupor when we was talking about stupor in the F0 catatonic stupor, in the depressive stupor, and now dissociative stupor. Yes, there are three kinds. Please remember stupor. Remember, I repeat, F0 catatonic stupor, F39 it is depressive stupor, and now dissociative stupor. Topic F40-49. It is psychogenic stupor. Another terminology, it is psychogenic stupor. You see the patients which is lying or sitting without any movements, but this person does not sleep, and unconscious. We understand. Then present information about severe stressor factors have gotten before, we must find, and chronological connection between influence of severe stressor factors. For example, we can collect information from parents, from friends, from colleagues, maybe from neighbors, and so on, and then find this chronological connection. Differential diagnosis should be to provide with catatonic stupor. Remember, depressive stupor, before I said, and exclude disorders of consciousness. We must exclude different disorders of consciousness and understand it is stupor dissociative. Next, dissociative disorders, motor and sensitivity. Usually this in clinical picture, patients lose sensations. Usually it is skin sensibility, and lose or feel difficulties in movements. Patients can look as sick with physical disease, for example, blood disturbances, for example, like to the neurological patients, and maybe with severe disease in some legs and so on. Examinations, the patients don't find the somatic disease. Then symptoms don't correspond then to physiological and anatomy parameters. For example, hyposthesia or anesthesia not corresponding to the physiological and anatomy parameters. And patients don't find the connection between their condition and stressor factors. Psychiatrists usually find connection, chronological connection between arising problems with hypoanesthesia and the influence of stressor factors. Now, for example, person like a sick of patients after stroke. After stroke, usually patients have many problems, organic problems, and he cannot walking very good because legs not control, problems with neurological innervation. Yes, here identical clinical picture. The person feel anesthesia or hyposthesia in the leg, very problem with gait, but really examination not find any signs of stroke. The patients deny influence of stressor factors. Usually they are sure that have a physical illness. For example, this person with dissociative paralysis, for example, maybe injured while he is in the psychiatric hospital. He must be directed to the neurological hospital because he or she has stroke and complications after stroke, very negative attitude to the doctor, and does not understand. Their behavior is directed on attracting the attention of other people. Usually these personal features of these people with dissociative disorders. And patients with dissociative disorders, personal characteristic, usually like and strive to be in the center of attention. It is a personal characteristics in what patients usually arise dissociative disorders. For example, more concrete disorder sensitivity. It is appearing disorders different after stress factors, decrease sensations or loss. For example, I repeat, anesthesia, hyposthesia. Loss sensation does not occur to neurologic innervation. For example, anesthesia on horizontal line lowers the level of knees. It is impossible at the disorders like to the stroke. Maybe lose the sight. Some people complain they not see. They lose sight, for example, but it is not total. Usually decrease sight or unclear sight. And they demonstrate unclear sight. They cannot read, for example, problems. They have fear, anxiety. And patient well makes work or safe productive activity maybe. Safe good orientation. They not fall down, for example. So we understand the person has normal sight. And complaints and behavior are not connected. Motor disorders, dissociative motor disorders, kinds. There are many kinds, maybe paresis, ataxia, abasia, tremor, aphonia, and so on. So there are many kinds identical to the symptoms of neurological disease. Yes. For example, paresis, decrease or lose sensibility in the legs, hands, maybe like to the hemiplegic, like to the patients with complications after stroke. Phobia of walking, ataxia, because they fall down, and chronological connection with stressor factors, and absence neurological disorders. So we should get consultation from neurologist, and we usually psychiatrists get a result of consultation. The neurologist write absence, any organic pathology, absence. So neurologist not find any organic neurological pathology. Ataxia, for example, it is disturbances of the gait, disbalance in walking, cannot walk self, needing the support, usually relatives support and help to these patients to walk. Fear to walk without help, they wait the relative, for example. They sure that have severe somatic illness, and these patients, and they don't pleasure that physicians direct them to psychiatrists. Usually with ataxia, the patients with relative address to the neurologist, to the therapeutist, for example, maybe traumatologist and so on, but no to the psychiatrist. And when family doctors or neurologists direct these patients to the psychiatrist, they have a bad perception why it is organic pathology, why you direct it to the psychiatrist, maybe conflicts. It is they not pleasure. Astasia, abasia, for example, impossibility to stand and work, but in position in the bed, in the horizontal position, patients can make all movements by legs. Lift, down, turn, for example, the legs in the bed. But if doctor asks, please stand up and walk, this patient cannot. She fall down on the floor. Aphonia, disappearing the voice, talking by whisper. Identical criteria before I was talking, and usually absence local pathology. In these cases, firstly, for the first time, every family doctor must direct to the exclude laryngitis, pharyngitis, angina, and other disorders. So it's local pathology. Maybe pathology with endocrinology, direct to the endocrinologist. Maybe problems to the oncologist, and so exclude any tumor and so on. After getting all results of examination, where any specialist exclude his disorder, only after that psychiatrist write it is aphonia, dissociative aphonia, because arise after stressful factors on the base of absent any organic pathology. Tremor, no identical diagnostic science, you should repeat identical science before. Example, for example, was in our practice. This girl was students was from medical college. She was directed to the psychiatric hospital. Very, very good students. The leader of the group was accused in the steal of jacket, although she did not take it. She was admitted in the police office, was very, very frightened. It was severe stress factors for this girl because never she did not influence, bad influence, never in your life she did not steal any objects, any jackets, any different things. It was impossible because she was in a very good family and so on. And she was alone in the city because her parents live in the region, in the village, and she lives in the hostel without any support and help from relatives. And after the stressful situations, factors, because in policemen they are have severe tension, they very influence, very negative on the mind of the person, and so after severe stress factor, she has problems with healthy mental health, and hyperkinesis appear in one hand. And she could not to continue learn. So it's very severe hyperkinesis. She cannot to sleep, cannot to eat. She had the different problems with emotions and so sleep problems, and severe hyperkinesis appear. And after this hyperkinesis, she could not continue to learn. Dissociative spasms or dissociative seizures. You should to differ from epileptic attacks, epileptic seizures, if you remember. I was talking about this. It is absence organic stigmatization. arising after stressor factors, dissociative seizures, arising in daytime, dissociative seizures not arise at the night, demonstrative attacks, people must be present, so it is not arising when the patient with dissociative disorder alone. Usually arise also before people, or also one man, one child, husband, wife, another relative, neighbors, and so on, maybe colleagues. And duration different without urination and pathological sleep. Due to the time, duration may be not 5 minutes, maybe 20 minutes, maybe hours, so differently. It is not like to the epileptic seizures, only short time, without without stages of convulsive, not absent tonic stages, clonic stages, not urination, not salivation, red salivations, and not arise pathological sleep after seizure. You should remember. And usually reaction of the bride present. When we examine these patients, the eyes reaction on the bride present. Somatoform disorders. If you remember on the previous lecture, I said there are 4 main topics, 4 main subchapters in this F49. It is, I repeat, anxiety phobias disorders, stress-related disorders. Now we finish dissociative disorders, and now 4th, somatoform disorders. Next topic. Somatoform disorders includes 4 points for structure from 4 points. First, it is somatization disorder, hypochondrial disorder, somatoform autonomic or vegetative dysfunction, and persistent somatoform pain disorder. Please remember. Somatoform disorder, general science. It is general science for all previous 4 forms of these disorders. Somatoform. I repeat this terminology, somatoform, you must differ, somatic disorders and somatoform. Somatic disorders, you will study and you study, there are many subjects, fields of the medicine, therapy, traumatology, therapeutic disease, endocrinological, cardiological, and so on. It is somatic disease because there we find any organic pathology. For example, if it is neurological disease, it is maybe tumor, cystis in the brain. If it is infection disease, we find different infection issues, for example, coronavirus and so on. We find virus in the laboratory tests. Somatoform disorders, when clinical picture identical, complaints identical, but results of examination, they are negative. Absence pathology, organic pathology is absent. General science, repeat arising physical symptoms, constant wishes to be exempt. In spite of negative examination results, patients continue to examine, visit the doctor. Being information about negative events around patients, psychological problems, denying connection between science and stressor factors, some level of hysterical behavior, and patients show that have somatic illness. It is general science, First, somatization disorder. These main characteristics, main features, or main diagnostic signs must be present plural, repeat, arising, often change somatic symptoms. They present long time, duration may be years before visiting the psychiatrist. No, plural repeating pains may be, for example, some time, the patient's complaints on the pains in the abdomen, gastrointestinal field. After some months after treating, appear pains in the heart. The patient go to the cardiologist and treat by cardiological treatment. Take, for example, maybe cardiologist find some very little, maybe the changes, maybe. Then after finishing treatment, maybe headache appear. The patient go to the neurologist and so on. So it's plural, repeat, different changes, somatic symptoms, for example, pains. Next, you see driving, visit different medical centers, hospitals, even have operations. Because pains repeat and treatment does not help, this patient go to another medical center. For example, not medical family center, after that go to the private medical center. Provide many examinations. Usually prevalent stomach sensations, usually it is pains in the abdomen, in the stomach, vomiting, nausea, maybe cardiological problems. Next, present anxiety and depression, because it is understanding, because if we have every time pains in the some months, it is understanding the every person will have anxiety, what happened with him, and has depression. Prevalence at the woman, and maybe drug abuse by analgesic. Because patients has pains long time, really she or he, usually she, use drugs, use analgesics very often, maybe every day. For diagnostic necessary being during no less 2 years, plural different somatic symptoms without organic basis. Then constant unbelief to doctors and refuse to take recommendation from doctors, and disturbances of social and family behavior. Because every day this, for example, mother has different pains, the poor children, poor husband, poor relatives, mother only maybe stay in the bed or go to the different medical centers, demonstrate depression, suffering. It will be, it has negative influence on the family. Differential diagnosis, physical disorders exclude. For the first time, we must exclude any physical disorder. Then depressive anxiety disorder must exclude, because you remember mass depression, yes? Hypochondriacal disorder, delusional disorders, because delusional disorder, hypochondriacal delusion, we must exclude. Maybe problems with thinking, maybe it is schizophrenia, maybe persistent delusional disorder, we must exclude. Next, second, remember hypochondriac disorder. Hypochondriac disorder, it is persistent preoccupation with the possibility of having one or more serious progressive physical disorder. Usually patients think about oncological disorder, maybe severe another disorder, and after some soon time, he or she maybe die. Persistent somatic complaints or persistent preoccupation with their physical appearance. Normal or commonplace sensations and appearance are often interpreted by a patient as abnormal and distressing. Every day, for example, we have today headache, maybe tomorrow, maybe discomfort in the epigastrium, and the another day, for example, another different sensation. But we don't think about this all day, not run to the doctor. It is normal, it is maybe normally today headache because bad sleep maybe and so on. As this patient with hypochondriac disorder, these patients usually normal sensations or little change of sensations, for example, today headache, tomorrow headache, and person begin to think about very severe disease, maybe tumor, maybe another disorder, maybe start the stroke and so on, and run to the doctor. The attention of these patients with hypochondriac disorder is usually focused on only one or two organs or systems of the body. For example, maybe cardiological and maybe brain, maybe only one organs, maybe severe headache every day and person consider he has cancer in the brain and so on. Often present depression and anxiety because everyday person suffering from these sensations, and secondary he has thoughts, negative thoughts, and usually arise anxiety and depression. The disorder is really present for the first time after the age of the 50 years, but maybe in the younger, it is not very true because maybe more younger, maybe students suffering with hypochondriac disease. Then disability is usually chronic and fluctuating, sometimes very good condition, then again exacerbation. Fears of the presence of one or more disease, for example, maybe oncological, I repeat, and the syndrome occurs in both men and women identical. Many people with hypochondriac disease with mild manifestation constantly turn to polyclinics, family medicine centers, and private maybe centers. A referral to a psychiatrist is often frustrating because they don't understand why they are directed to psychiatrists, because consider they have a concrete somatic disease. Some people dominate or manipulate family and social media as a result of their symptoms as opposed to a minority that functions almost normally. То есть manipulate that the patients, they say they have different sensations, problems, severe disorders. They cannot continue to do some domestic things. Please, you will cook, you will go to the work, and so on. To direction to the members of the family. Differential diagnosis with somatization disorder, with depressive disorder exclude mask of depression, delusional disorders, maybe hypochondriac delusion, maybe hypochondriac disease. This you must differ. And anxiety and panic disorder exclude. Next, third, somatoform autonomic dysfunction. The symptoms are present by the patient as if they were due to the physical disorder or a system or organs that is largely or completely under autonomic innervations and control. For example, cardiovascular, gastrointestinal, or respiratory system. For example, patients complains only tremor, or complains only palpitations, or complains only hydrosis. It is a system, for example, or maybe problems with respirations, and so on. Symptoms are usually of two types. The symptoms are not indications of a specific medical condition. First type, here complaints are based on objective signs of autonomic arousal. There are, for example, I repeat, palpitations, sweating, hot flushes and tremors, and so on. Second time, subjective and non-specific symptoms, for example, sensations of fleeting pains, burning, heaviness, tightness, feeling of bloating, and so on. Diagnostic. No, must be symptoms, for example, complaints, palpitations or sweating or tremor, for example, they must be persistent. Second, additional subjective symptoms, maybe. Preoccupation with and distress about the possibility of a serious disorder of the state organ or system which does not respond to repeated explanation and reassurance by doctors. No evidence of significant disturbances of structure or function of the state system or organ. То есть during examination, the doctor does not find any organic pathology. And fourth, persistent somatoform pain disorder. Here usually complaints on the persistent severe pains, maybe pains, which cannot be explained fully physiological process or physical disorder. То есть severe pain, for example, young woman, for example, has severe pain in the chest, but any pathology absent, for example. Pain occurs in association with emotional conflict or psychosocial problems that are sufficient to allow the conclusion that they are the main causative influences. We must find chronological connection between psychological problems. Maybe these problems very little for us, for around people, but for this person it's very, very important. For example, long time the woman cannot be married, she has not children, maybe she is old, 40, 45 years, and she's suffering last, for example, 10 years, yes? It is very, very important, severe problem for this woman. And maybe arise persistent somatoform pain disorder, because her problems influence on the organs or on the system and appear, for example, severe headache. The result is usually a marked increase in support and attention, either personal or medical. Usually in the persistent somatoform pain disorder, usually in the clinical picture, usually complaints on the psychalgia, different pains, for example. Usually we see it is what you see, psychogenic backache or headache. Usually headache, very often complaints, it is persistent headache. We observe they take treatment very long time at the neurologist. Then it is not effective, only some time recovering, maybe feel better 1 month, 2 months, then again severe pain again appear. And somatoform pain disorder, for example. Usually, please remember, maybe to hear mistake, backache, headache, and usually at women, very often it is pain in the genitalis, gynecology pain. Other somatoform disorders, please remember, in this disorder, the presenting complaints are not mediated through the autonomic nervous system and are limited to specific system or parts of the body. We find, for example, we have patients with globus hystericus. It is a terminology due to the ICD-10, feeling of a lump in the throat causing dysphagia. Other forms of dysphagia. For example, one woman, she had many family problems with husband, she had 3 children, little, salary is not high at the husband and so on. So it's many problems, and sometimes appear sensations of globus hystericus in the throat, and she cannot to eat very good because appear dysphagia, appear dysphagia. Psychogenic torticollis and other disorders of spasmodic movements, for example, maybe psychogenic pruritus, maybe psychogenic dysmenorrhea at the woman, at the young woman, often maybe connected with stressful factors, for example, with marriage, maybe with other problems, with parents, with communications, with problems in the life, in the education, for example, all combination, many stressful factors. Maybe teeth grinding. Teeth grinding very often we observe at the children, at the maybe adult, and usually in the medicine cannot find what the concrete origin of teeth grinding, but in some cases we can say about other somatoform disorders and consider teeth grinding in the topic of F40-49 because we find stressful situation for this person, concrete for this person. Так, we finish topic 40-49. Please, it's your home task. Goodbye.